we go. But hello and welcome, everyone. My name is Adrienne Burgess, and I'm the Director of Perinatal and Neonatal Quality and Patient Safety for the Maryland Patient Safety Center. I wanted to begin this webinar by acknowledging that this week is Black Maternal Health Week. Black Maternal Health Week is recognized each year from April 11th through the 17th to bring attention and action in improving Black maternal health. Everyone can and should play a role in working to prevent pregnancy-related deaths, improving maternal health outcomes, and eliminating disparities. Today is our kickoff webinar for Maryland Patient Safety Center's collaboration with Healthy Birth Day to bring Count the Kicks to Maryland. Count the Kicks is an evidence-based stillbirth prevention program that provides educational resources to healthcare providers and expectant parents. Unfortunately, many families are affected by stillbirth. A study from the Centers for Disease Control and Prevention found that Black mothers were more than twice as likely to experience stillbirth compared to Hispanic and white mothers. So in an effort to eliminate preventable stillbirth and the disparities in this outcome, the Maryland Patient Safety Center wanted to ensure all Marylanders have access to the education and materials developed through this evidence-based program. Our hope is that by bringing this program to Maryland and providing Marylanders the same education and having access to the same resources, we can improve outcomes for moms and babies we serve. So with all of that said, I want to welcome our two friends from Count the Kicks and Healthy Birth Day, Jody Long and Megan Ockett.
You got it. Thanks so much, Adrienne. We are so excited to be here today. Thank you for giving us an hour of your time. On your screen right now, you'll see just some of the beautiful baby faces, some of the baby saves that we have where parents have contacted us and said, I was using Count the Kicks. I knew about it. I knew about the importance of tracking my baby's movement, and baby's here because of it. And yes, huge shout out to the Maryland Patient Safety Center. We partner with them to bring our evidence-based program here to Maryland. We're very excited about this launch. We're so happy you're all here today, and just huge shout out to Maryland Patient Safety Center, because without their partnership, this webinar like this wouldn't happen. The materials are free because of them. So we'll reference them quite a bit throughout the presentation. And I know you all know Adrienne, or you will soon, but we'll be in touch lots of different ways throughout the year. So we're excited you're here, and we're going to go ahead and show you just a little bit more about truly what Count the Kicks is. So let's watch.
We're going to turn now to that GMA parenting alert about a free app a mother says helped save her baby's life by tracking how often she kicked.
Oh, a little delayed. Let's let it buffer a little bit.
So this mother says that everything was completely normal in her pregnancy until one day, thanks to this app, she noticed that something was off. Well, it turns out her baby was in real trouble.
For Emily and Jeremy Ecoff and 2-year-old Liam,
Oh, nice.
life with their new baby Ruby is extra precious.
We have a healthy baby girl, and we could have had a burial instead.
Ruby is lucky to be alive, and her mom says that's largely thanks to an app. The free app called Count the Kicks aims to prevent stillborn deaths by helping moms record their baby's movements.
You can just tap the baby's footprint every time you feel a movement. A movement could be a kick, a roll, or a jab.
Used at the same time every day, the app tracks how long it takes to reach 10 kicks, helping mom learn what's normal for her baby.
And we also send calendar reminders and text reminders so that moms are reminded to do it once a day in the 3rd trimester.
It's just one of a growing number of apps helping parents through pregnancy and labor. For the Ecoffs, everything was going smoothly until one day last month.
The kicks were not happening as frequently as they usually did. And when she did move, it was really like soft, subtle, not like hard kicks like normal.
Emily knew from the app that her baby normally kicked 10 times in under 10 minutes. So when she only logged 3 kicks in an hour, she rushed to the hospital.
All of a sudden, they came in and said, you're going to have an emergency C-section.
The umbilical cord had wrapped around the baby 3 times, limiting her movement. Doctors delivered Ruby just in the nick of time.
Not only has Ruby been saved, but potential generations have been saved.
She sleeps about 23 hours a day.
4 weeks later, Ruby is now home, healthy, and sleeping like a baby.
Doesn't get much cuter than that. Now, the app was made in Iowa, which is where that family is from, but the creators say it's now spreading nationwide, thanks in part to Ruby. Since the news of her birth, the app has gained more than 5,000 new subscribers. So Robin, the app saved Ruby, and by raising awareness, she may end up saving many more.
That's just one of our stories that we have, and you can always access all these on our YouTube channel, and we'll send them in a link afterwards, but it just goes to show you the power of that storytelling. And then your very own Maryland baby save, Mabel Rose. Look how adorable she is. Her mom contacted us and said, I learned about Count the Kicks, I was using the app, and now Mabel's here because of it. So we want to see these PowerPoints filled with baby saves from Maryland, and that's our hope today, is that we're giving you the tools and resources to learn more about stillbirth prevention best practices, but also the tools and resources to be able to talk about stillbirth prevention and Count the Kicks with your patients, with your community members, with your expectant parents. 159 Maryland babies could be saved every year with our program. And we'll talk a little bit later about how we get to that number, but just keep that in mind. Almost 159, 200 babies could be saved with this program in Maryland specifically.
This slide got out of order, but in case you were wondering who we are, Megan Ockett has been kicking off this webinar, and so we're so thankful for her to do that. She's our program director at Healthy Birthday. My name is Jody Long. I'm the Health Equity Director for Healthy Birthday. And so you can contact us right here if you'd like with our email addresses, but we'll go ahead and continue on with our presentation. So you might be wondering more about what Count the Kicks is. It's a stillbirth prevention program. It's evidence-based and it's mom-centered. It educates expectant parents on the importance of tracking a baby's fetal movements every day in the 3rd trimester of pregnancy. That's starting at 28 weeks. And what this does, it empowers them to learn what's normal for their baby's movement pattern, and then to speak up to their doctor if they notice a change or have any concerns with their baby's movements as well. So let's make sure that we are on the level playing field here, working off the same definitions and understandings of some terms that you will be hearing throughout this presentation. A miscarriage is usually defined as the loss of a baby before the 20th week of pregnancy, but a stillbirth, however, is the loss of a baby after 20 weeks of pregnancy. On average, 22,300 babies are born still every single year in the US. You might be familiar with the term infant mortality. That is the death of an infant before his or her first birthday. But when we're talking about stillbirth, that is referred to as a fetal death. On average, roughly 20,000 infants die every single year in the US. All right, so let's talk some numbers, shall we? So nationally, 1 in 173 pregnancies end in stillbirth. But when you break that number down by race and ethnicity, you can see that racial disparities persist. I want you to focus on 3 critical demographics that are more susceptible to stillbirths. 1 in 94 Native Hawaiian and Pacific Islander pregnancies end in stillbirth. That number for Black pregnancies is 1 in 97. And for Indigenous pregnancies, that number is 1 in 128. Out of those 3 demographics, their numbers have either barely improved or gotten drastically worse. The COVID-19 pandemic has increased the urgency for this work because the virus has the ability to interfere with pregnancies, and has also changed the structure of our healthcare system that also negatively impacts those who are women of color or expectant parents of color. Also notice at the top of your screen that's bolded there in Black that families are 6.5 times more likely to lose a baby to SIDS, or are more likely to lose a baby to stillbirth rather than to SIDS. We know that the public health campaigns work and can be really effective because the rate of SIDS has dropped by 50% due to that oh so famous Back to Sleep campaign. We would love for fetal movement monitoring to be talked about just as much in order to make a big difference. So in 2020, the national stillbirth rate was nearly 6 stillbirths per every 1,000 live births. In your state of Maryland, the stillbirth rate is nearly 7 stillbirths per every 1,000 live births. Maryland loses on average 496 babies every single year due to stillbirth. You can see on the graph that the line that is red represents your state of Maryland. The teal line right below it represents the US, and the yellow line below that represents Iowa, which is where Count the Kicks was founded and first implemented. Our goal of partnering with your state is to make sure that Maryland is more reflective of Iowa's success. So as mentioned in the previous slide, there is a large divide when it comes to those who are more likely to experience a stillbirth. And I wanted to take a moment to share what research has shown to be some of the contributing factors to those disparities in birth outcomes. So structural or systemic racism is one of the biggest points, right? Or the way that society fosters racial discrimination through mutually reinforcing systems like housing, education, employment, even healthcare. There's also something called epigenetics, and that explains how early experiences, whether they're positive or negative in someone's life, can have a lifelong impact on them. So environmental influences can actually impact how genes are expressed. Life experiences can literally rearrange the epigenetic marks that govern gene expression, and they can change whether and how genes release that information. There's also things like predisposition to certain conditions that may lead to stillbirth, like gestational diabetes or preeclampsia. Preeclampsia is something that as a Black woman, I endured with my second pregnancy this past summer. Very scary situation there. Access to healthcare, socioeconomic barriers are also issues. But it's also important to note here that research shows that education is not a determining factor in one's birth outcome. A college-educated Black woman is still more likely to lose her baby than a high school educated white woman is. So you might be wondering what Count the Kicks and Healthy Birthday is doing to reduce racial disparities within our organization and how we do our work. First and foremost, we're listening. We are working within people in cities and states by improving programming based on women and parents' lived experiences. They share them to us via focus groups or surveys and one-on-one interactions. So as we learn more, we are identifying solutions and work within our partners on implementing those. We also created our first health equity team that is dedicated to focusing on improving systemic factors that impact birth outcomes with pregnant people who are most at risk. We also work very closely with our partners on the national, state, and CBO level. We cater to marginalized groups who can help us plan and strategize and implement Count the Kicks in a way that expecting parents can receive that information and put that information to practical use. We're also really proud to say that Count the Kicks, our app and materials are offered in a number of languages. Our Count the Kicks app, in fact, is offered in 16 different languages. In our materials, we offer them in a number of different languages as well. As for your state, we have those available in English and in Spanish for no cost. Free 99 is always the best cost, right? We also utilize grant funding to help with tasks that make our message more accessible, like using that money to add languages to our app or translate our materials. We also work with state partners who can look at data and help us kind of pinpoint where there is more of a problem or need to have intentional focus so we can promote free events and resources in those areas more heavily. And lastly, outreach and making sure that our materials are going beyond doctors' offices and working with organizations locally and even places of worship, even hair salons. We know the positive influences that these areas can have on a pregnant person's life and areas that they might frequent more than their doctor's offices as well. So now I want to hand it over to Megan, more about the research and evidence behind our program.
Thanks, Jody. And as we're talking for the next 45 minutes, I really want you to be thinking about how you can integrate this into your workflow. So you're all coming up from a variety of different avenues. You're coming from home visitors, health departments, state health departments, county health departments, doctors' offices. There's lots of different ways that you can integrate Count the Kicks into your workflow. So we'll talk about it a little bit later on, but be thinking of that as we're talking today. So yeah, let's talk about research and evidence, always top of mind, right? Go ahead and go to the next slide. There you go. So when we talk about how Count the Kicks is an evidence-based campaign, what we mean by that is the fact that we're based on evidence specifically from this study out of Norway. So Count the Kicks was founded in Iowa, like Jody said, and it was founded by 5 central Iowa women who all experienced stillbirth or infant loss in the early 2000s. They didn't know each other at the time of their loss. They got connected through pastors and friends. And as they started grieving together and thinking, how did this happen? Like, here we are, 5 central Iowa women who all experience relatively the same situation in relatively the same amount of time, yet we're told this doesn't happen very often. We're told this like getting struck by lightning. Now we know, and they knew then, that is a lot more common than people think. So fast forward, some of the founders were at a public health conference where they heard these researchers out of Norway talk about a study that they did that showed when expectant parents were educated on getting to know what was normal for their baby in the 3rd trimester, when expectant parents were educated on getting to know what was normal for their baby, that the stillbirth rate among that cohort of women decreased around 30% in the study. The founders, these women hearing this from Iowa, were like, oh my goodness, that's amazing. Kit County's been around for a long time, but what if we created the tools and resources for us here in Iowa and potentially the United States to make it easy to talk about stillbirth and stillbirth prevention, to make it easy for parents to get to know what was normal for their baby in hopes that they can speak up to their provider. So that's what they did. They came back to Iowa. They got some funding from the Iowa Department of Public Health. They worked with a local marketing company. Knowing firsthand how devastating stillbirth is, they created a bright, colorful, empowering campaign, all based off this evidence. There's additional evidence and research on our website all around the support of fetal movement monitoring. So feel free to always go to our website and click on the evidence page, and you'll see lots of different journals and research. But I'm going to highlight a couple more here as we go throughout. Go ahead, next slide. So one of the things that just happened is we worked with a prominent international stillbirth researcher, Dr. Alexander Hiesel from the United Kingdom. And what he did and his team looked at the Count the Kicks implementation in Iowa from 2008 to 2018. And what he found, and he compared it to surrounding states that didn't have Count the Kicks or any sort of stillbirth prevention program. And what he found was Iowa has had a 1% decrease every 3 months with this research because of the Count the Kicks campaign. And so this just was released. This research was released in the International Journal of Obstetrics and Gynecology. Again, you can read the whole journal article on our website, but we actually pulled together a video that kind of highlights some of the key findings from the research. So let's go ahead and watch.
We know that there was no other sort of public health campaign going on in Iowa related to stillbirth at the time, and we know there's a relationship between the activity of Count the Kicks and the changes in stillbirth rate.
Prominent stillbirth researcher Dr. Alexander Hiesel led the study that shows birth outcomes improved when moms learned about Count the Kicks.
And I think there was no doubt from the data that we saw a massive jump in the app downloads when there was a TV appearance. And I think ultimately as human beings, we are hardwired to listen to stories. You know, you can hear people like me talk about data all day long, and after a while people's eyes kind of glaze over and you can see that you've lost them. If you combine that with a story from a mum who kind of, you know, as you said, narrated how her experience identifying that her baby wasn't well because it wasn't moving normally, and then someone listened to her, took it seriously, did the tests that were needed, the test showed that there was a problem and the baby needed delivering, then that people listen to that and it touches them somewhere that numbers just don't.
Research shows that in Iowa, when more moms used the Count the Kicks app, more lives were saved.
Count the Kicks has had such an impact in helping mothers believe in themselves and believe in that they know what's happening within their own bodies, and then their ability to talk to a doctor in a way that they'll listen to, that the mom does know what she's talking about, because it gives them the tools to be able to show to the doctor when there's been a change in those kicks.
The Count the Kicks app is a data download for your intuition. Paying attention to your baby's movements is a great way to monitor your baby's health in the 3rd trimester. Download the free Count the Kicks app and get counting today.
We actually have a longer video too. There you go. We have a longer video too that you can watch that goes into a lot more detail of the data. But basically what he was talking about is what you see on the screen. So we're giving you a lot of different ways to learn and take in all this information today. So if you look at the screen, that little box where it says Count the Kicks launches in Iowa in 2008, you can see that downward trend, that dashed line. Exactly, Adrian. This is exactly what we want to see happen in Maryland. So we've had that 32% reduction in those 10 years, 2008 to 2018. The first 5 years of the campaign, we saw about a 39% reduction among African American stillbirth rate. So yes, there's some outliers there too. Things like syphilis outbreak, which is all across the country right now. Pandemics like COVID can also impact birth outcomes. So there's stuff beyond our control. And we know that not every stillbirth is preventable, but from those that are, we want to see this 32% or more reduction in your state. Like, blow us out of the water, Maryland. Like, you guys can do this. Like, let's go. So how do we get to this 32% reduction? How do you in Maryland get to this 32% reduction? Well, one of the first steps to do is order our free materials. So we have posters and brochures and app cards in English and Spanish. You can go and you can scan this QR code. I'll put the link in the chat too. And so one of the things that we really want to do right now is spend 2 minutes of this presentation. We're going to play a fun song, and I want you to go to the website right now, click on order materials, click on Maryland, and fill your shopping cart and order today. We're also doing a giveaway for an Amazon gift card for a drawing for orders that are placed today during the webinar. So you have no excuse, you're right here. So let's take a couple minutes, don't go anywhere, just go order your materials. We're gonna listen to Pharrell Williams here for a second, and we'll come, oh thanks, Adrian's on it. So go order your materials, and then we'll loop back to talk about some more research and then how you implement this with the materials.
It might seem crazy what I'm about to say. Sunshine, she's here, you can take a break. I'm a hot air balloon that could go to space. With the air, like I don't care, baby, by the way. Because I'm happy, clap along if you feel like a room without a roof. Because I'm happy, clap along if you feel like happiness is the truth. Because I'm happy, clap along if you know what happiness is to you. Because I'm happy, clap along if you feel like that's what you want to do. Here come bad news, talking this and that. Oh, give me all you got and don't hold it back. Well, I should probably warn you, I'll be just fine. No offense to you, don't waste your time. Here's why. Because I'm happy. Clap along if you feel like a room without a roof. Because I'm happy. Clap along if you feel like happiness is the truth. Because I'm happy. Clap along if you know what happiness is to you. Because I'm happy. Clap along if you feel like that's what you want to do.
They are free 99. So just to be cognizant of everybody's time, go ahead. I know we can all multitask. So go ahead and keep ordering materials. Again, you'll be entered into a drawing and win a $25 gift card to Amazon. Plus, it helps you save babies and educate expectant parents in your area. So we're going to go to the next slide so we can keep things moving here. So one of the top questions that I get is this going to increase anxiety in expectant parents? Is this going to increase calls to my nurses with this? So let's address these issues head on. Let's take a look at some of the research. So we have research. There's research out there that shows that there's no increase in hospital utilization. This research study that you see, this quote I pulled from that says, usually the fetal movement is reassuring, the count is reassuring to pregnant women and prevents unnecessary visits. And I'm going to tell you why in a minute. They also stated that decreased fetal movement can indicate a need for more evaluation and has the potential to save lives. And then as far as the anxiety part goes, is there's research out there. We've done our own research on our thousands of app users that show 84% of app users stated that regular tracking was associated with feelings of bonding, and 77% of app users reported feeling less anxious. Because what happens is you now have data in your hands. An expectant person has data in her hands. It's quantifying her gut. It's quantifying that movement to share with her provider. So now she is a highly educated individual that understands what's normal for her baby and when and how to speak up versus I'm not sure. Was it 30 minutes? Was it 45 minutes? Now we have data in our hands, and that's why this does not increase hospital utilization. That's why this helps with anxiety, because now they feel comfortable, they feel knowledgeable, and bonding. Like, let's focus on baby. We choose a time every single day in the third trimester. We can include siblings. Come sit with me while we feel baby brother's movements and read a book to him. So we have the research that supports this. And again, go to our research page, our evidence page. And if you really like reading journals like me, have at it. There's a lot on there. So go ahead and next slide, please. I think there's also a misconception that somebody's going to call and it's going to be an automatic C-section. We're going to have an increase in C-section rates, right? That has not happened in Iowa. That has not happened elsewhere. That doesn't happen because remember, this is a way to check on baby. 9 times out of 10, everything's good. We want to make sure we catch that one time. And even if something is caught, that doesn't necessarily mean it's an automatic C-section. Sometimes we catch things early and reduction of preterm birth rate can be identified. Fetal growth restrictions can be identified earlier. Our own CEO, she went into triage because she had a reduction in fetal movement when she was 30 weeks pregnant, found out her son was trying to be born a little early. So they did a couple of things. She was on bed rest for a while and delivered a healthy baby boy at 40 weeks. So this is a way to check on baby. I think as humans, we always go to that worst potential case scenario, and I get it, but Jody and I are here to tell you that that doesn't happen. This is a good thing. It's a non-invasive, it's free, easy to use, and easy to understand. I think it's really important to note too that women who have stillbirths are at a substantially higher risk for severe maternal morbidity than women who have live births. In fact, you're 4 to 5 times more likely to experience a stillbirth over white women. So because of this, what we wanted to do is we wanted to create a white paper that discussed this connection, this intrinsic connection between stillbirth and maternal mortality morbidity, because it's, maternal morbidity and mortality is such an important topic and needed to talk about. And I feel like finally as the US, we're slowly getting to that point where we're addressing it. We obviously need to do a lot more, but we wanted to create this white paper that talks about firsthand accounts of real people who were using the app, who understood what was normal for their baby, spoke up, and not only did it save their baby, but it also saved their own life. So you can access this again on our evidence page, a white paper. It was released last year. It's really powerful impact. So it's just something to think about as not only are we potentially preventing preventable stillbirths, but also saving mom's life as well. So it's a win-win, right? Next slide, please. All right, Jody, take it away. Now we know the data and research. How do you implement this? Jody's going to tell you how.
All right, so let's talk about why does movement matter? Well, movement is just one very important way that baby communicates with mom before birth. A change in a baby's movement can be an early and oftentimes only warning sign that a baby may give when in distress. So when should a mom or an expectant parent begin counting their movements? Well, ACOG recommends beginning counting at 28 weeks of gestation, which is the start of the 3rd trimester, or 26 weeks if considered high risks or is pregnant with multiples. This is when research shows that baby has established a consistent pattern that mom can feel and track. And consistency and kind of learning what is normal for your baby is what we really encourage moms to hone in on so they know what is normal. So if something were to change, they can say, hey, I know this is not right. So what counts as a movement? A roll, a kick, a jab, a push, anything except hiccups, which if you're talking to a first-time expectant parent who may not know the difference between some of those feelings, you can describe a hiccup as the sensation of like a rhythmic pulse, if you will. So let's take a look next about how Count the Kicks works, how the app works.
The Count the Kicks app, a cutting-edge, powerful tool for expectant parents in the 3rd trimester of pregnancy, has a new feature to help you monitor your baby's movements. The new strength feature allows you to rank the strength of your baby's movements on a scale of 1 to 5, from fluttery to fierce. Research shows paying attention to the strength of your baby's movements is vital. If a baby's movements becomes weaker, studies show this could be a sign of potential problems, and expectant parents should alert their doctor. The free Count the Kicks app now gives you the option to take notes on your session. Our app is available in 12 languages in the Apple and Google Play app stores. It is a simple and non-invasive way to monitor your baby's well-being every day in the 3rd trimester. Features include kick counting history, daily reminders to count, and the ability to count for single babies and twins. Simply tap the footprint every time you feel a kick, roll, or a jab, and the app will time how long it takes your baby to get to 10 movements. Log in to save your kick counting data and get to know what's normal for your baby. Be sure to speak up and tell your doctor if you notice a change in the strength of your baby's movements or how long it takes your baby to get to 10 movements. Hospitals are open 24/7 and are ready to listen to your concerns. Join the community of expectant parents who are in tune with their body and their baby by counting kicks daily in the 3rd trimester. You can also find it on Apple Watch. Download Count the Kicks and start counting today.
Absolutely loved using the app during both of my pregnancies with my kiddos. It's really important to note that this app is free. We like to give things out for free around here, right? So the free app has been downloaded over 200,000 times in over 140 countries. What's great about the app is that you won't find any advertisements or pop-ups, so it allows mom to be totally focused on counting baby's movements. We always and regularly survey our app users and listen to their feedback and make any changes or improvements when necessary. Since that video was made, we've added some more languages to our app. So our app is now available in 16 languages. And if mom gets interrupted during a kick counting session, she's able to restart that kick or delete the kick. I know that happened quite frequently during my pregnancy with my second child. My toddler loved sitting down with me during his nighttime story time to count baby sister's kicks. And so that was a great time for him and I to bond and to bond with the baby. But sometimes he got a little too tap happy with counting sister's kicks. So I had to sometimes go back and delete when necessary, but that's a great feature to have. Also, we know that expectant parents are really busy and also forgetful. So we have a tool available within the app that you can set a daily reminder because we know that, mom brain is real. You can so you can set that daily reminder to help you remember to count those kicks. And then after a few days, of course, like we've mentioned before, you'll begin to notice a pattern for your baby. So for my son, for example, it took him about 5 to 7 minutes to hit those 10 movements every single evening. But for my daughter, her normal was about 13 to 15 minutes. So again, having that expectant parent know what is normal for them is crucial for them to be able to speak up if they notice a change. We also have that kick counting history available for parents to access as well. Monitoring the strength of the baby is also very important too, because it's not just if your baby is moving or if someone's baby is moving, but how they're moving as well. So we can rank that from fluttery to fierce. Fierce being, that hard, almost alien-like push out of someone's tummy. But the fluttery, those kind of feels like when you first got when you're first starting to feel the baby move, and it's kind of like that tickle. Again, the strength of how a baby is moving could also be a sign that baby might need some help.
And I'll just add really quick, Jody, one of the questions I got earlier today was Haitian Creole. So we don't have the print materials in Haitian Creole in Maryland, but we do have, the app is in Haitian Creole. So like we said, there's 16 languages, but you know the community best. So if you have a community need, let us know, because that's how we make this accessible and inclusive and better, is that we want to meet your needs. So if you have a population, a demographic, whatever that is, let us know how we can help. And then we can work with the Maryland Patient Safety Center. We can look for grant opportunities and things like that to make sure we're meeting your needs and the needs of your community.
Definitely. Yep, it's been done before. If you are a pregnant person that does not have access to a mobile device, there's no problem with that. We have recently launched the web-based kick counter that lets parents count their baby's kicks and movements on a desktop or a laptop. It has all the same features as the app does, so we make it really easy for moms or expectant parents to count kicks at work or at a friend's house. Even they can have access to this at their public library. So we want to make it as easy and accessible for everybody out there.
And I'll just add one more quick thing with that. So if you count on the web, like a PC, and then you count on the phone the next day, and then you count on your Apple Watch the next day, it all syncs together. So there's lots of opportunities to count. We cannot stress enough the importance of counting daily around the same time. So if you take one thing away today, it's you are going to push this and have this, have your parents count daily around the same time. That's key, because that's how they're going to know the trend and what's normal for their baby. Go ahead.
Yeah, thanks for stressing that. That's really good information to have. We also know that those who use our app or web counter might be in need of other services to help them or their families during their pregnancy. So on our Count the Kicks platform, you'll be able to find in the menu section a resources tab. So by clicking that tab, users are able to enter in their zip code and find free or reduced services that they need. So maybe they're looking for housing or food help, or maybe even a doula. This area on our Count the Kicks platforms can help direct them to those services.
Thanks, Jody. So as we continue this implementation discussion, let's talk about how you're increasing the health literacy of your community, of your patients and pregnant people. We know, and you probably know, health literacy is one of the strongest indicators of an individual's health status. So we're going to give you some ideas of how you're having this conversation, those open-ended questions, motivational interviewing techniques of how to increase the health literacy. So here are 5 ways you're going to be equitable. You're avoiding assumptions and providing this to everybody, no matter what, no matter their race, their gender, their socioeconomic status. It's the same information. It doesn't change. It's the same information no matter what. You're listening and you're learning. You're asking strategic and open-ended questions. It's not just a question at 20 weeks saying, have you felt baby move? Yes or no. It's tell me about your baby's movements. What questions do you have about your baby's movements? Let's look at your data together. Every single time you see them in the 3rd trimester. If you are a home visitor or WIC listening today and you don't see them every week or every other week, and you see them maybe at 25 weeks, and then you're not going to see them again until 32 weeks, go ahead and talk to them about this at 25 weeks and say, here's a brochure. I want you to download this, and then I want you to start using it in the 3rd trimester. Here's what it is. Here's how it works. When I see you again at 32 weeks, I want to see all your data. And then always know you can contact your provider if you notice a change, or go to your nearest birthing center if it's after hours and you can't get a hold of everybody, because hours and minutes matter. So you're listening and you're learning. You're being clear and concise. You're avoiding long or complex explanations. So Jody and I are doing that quite a bit today, right? We're using terminology like fetal movement and, things like that. So you're going to say baby movements, baby kicks, baby jabs, pushes, that type of thing. And you're being honest. We're going to talk about this here on the next slide, but stillbirth is something that we need to be talking about. We talk to pregnant people all the time about things that could happen. We talk about, I was scared, so scared to eat lunch meat. That was just ingrained in me. Don't eat cold lunch meat, microwave it. Like, why was that ingrained in me? But nobody told me about the importance of tracking fetal movement until my 3rd, which is in 2018. The app came out in 2015. So we need to kind of change that narrative a little bit. You're speaking truth while also practicing empathy and compassion. And then you're reteaching, right? If patient displays confusion or a lack of understanding, you're making sure to correct and clarify. This is why it's also really important to talk to them about it every single time you see them in the 3rd trimester. We understand that this can be scary and hard to talk about. You don't want to scare parents. And again, pregnancy is full of risks that we talk to expectant parents about. Stillbirth is another risk that expectant parents deserve to be educated about. Stillbirth just happens, there's nothing we can do. But we know, and research shows, there are warning signs. Remember, a change in fetal movement is one of the first and sometimes only sign that baby's in distress. So this is so important to be talking about. My baby's always active, it's not a concern. I guarantee you are going to get this response when you talk to expectant parents about this. Oh, I don't need to do that. It's like a jungle gym in there. I get it. I've had 3 babies. My son, it was 5 minutes or less. My daughter took about 30 minutes. I went to triage 3 times with her because I was comparing her to my previous pregnancy, and I didn't know that was her normal when I was tracking that during that time of day. So how great would it have been had the triage nurse printed out an after visit summary with how to count the kicks, which we do now have, and we'll show you in a minute. So we want people to be counting even if they know and believe their baby's active. It takes the guesswork out of knowing that too. I'm almost at my due date. The risk of stillbirth increases as an expectant parent approaches or exceeds her due date, and it increases quite a bit. So we really want to be monitoring our baby's movement. So now Jody and I are going to do a little role play. Jody's going to be my doctor and I'm going to be the patient. So the first one again, Jody, I don't need to count my baby's movements. It's like a jungle gym in there. I never get a moment's peace. It's like a trampoline on my bladder.
Right. Well, even babies that are active can experience distress, sometimes quickly and without any warning signs at all. So that's why, of course, we're stressing it's really important for expectant parents to track baby's movement every day and takes the guesswork out of knowing if a normally active baby has slowed down. So count the kicks, like we showed you before, shows you and gives you real data to show your healthcare provider if you have any concerns.
Okay, Jody, Dr. Jody, but I am not high risk, so I don't need to count, right? Like I've had a perfectly healthy, wonderful pregnancy. I'm glowing. It's fine. I'm not high risk.
Yeah, definitely a really common misconception. All expectant parents should be educated on count the kicks and get to know what's normal for their baby.
Well, I was searching Dr. Google and saw that I should only get 10 kicks in 2 hours, and that's all I need to pay attention to.
Oh gosh, that 10 and 2, that is outdated. Every baby is different. And the recommendation to expect 10 kicks in 2 hours is kind of a thing of the past. Current research shows that moms should work to understand what's normal for their baby, the normal amount of time each day that it takes for the baby to get to 10. So great question.
Yeah. I'll take off my pregnancy hat for a second. I'll give an example of this too. There is a research study on our website about this 10 and 2, because I know this is a comment, or 10 and 1. And what I want to say about this is, and what the research study says is, I'll share it this way. As individuals, as humans, we're focused so much on the time, right? Like Jody and I know we have 60 minutes for this. We have an hour, you know, it's your lunch hour, that type of thing. So when we say 10 and 2 and we say 10 and 1, if we have somebody that's been counting and we're counting regularly, and for the last 2 weeks, they get 10 movements in 15 minutes. And one day they count and they get 10 movements in an hour and 15 minutes. That's a significant change, right? But they think to themselves, I've always been told it's 10 and 2, so why do I need to call? But that's not my baby's normal. My baby's normal for the last 2 weeks has been about 15 minutes, not an hour and 15 minutes. So you could see why we're stressing so much about counting daily and getting to know what's normal for your baby. So you can speak up and you know, okay, that's not my baby's normal, 10 and 2, whatever, like we know what's normal and we're going to contact our provider. So again, there's a research study on it. So now I'm pregnant again, I'm in my 3rd trimester. Jody, I downloaded an app that I can use a Doppler and I can find my baby's heartbeat with. That's okay, right?
Yeah, tempting and so common to do, but a change in the baby's heartbeat is actually one of the last things that occurs when a baby is in distress. A change in a baby's movement may actually indicate potential problems before changes in the heart rate are found. So expectant parents should only use a Doppler device under the guidance of their healthcare provider. Great question.
Got it. I'll delete that app then. Okay, Jody, my baby's not moving very much, so I'm going to go ahead and drink Mountain Dew and eat a Snickers bar and probably do jumping jacks, okay, to get baby to move.
I think any mom, grandma, auntie has given this suggestion. I know my own family members did as well, but research shows that we're moving away from the idea that sugary drinks are a good way to get baby to move. Just like when you or I are sick, we're not going to hop up off the couch and run to the fridge and grab an orange juice from the fridge to help us get us going. A baby is the same way. They're just going to lay around. They're going to be sluggish. They're going to be slow to move. Very similar to what we experience with that. So kick counts are best monitored without interventions like juice or candy. If a baby isn't moving normal, parents should contact their doctor right away.
Well, Jody, I'm at 9 months pregnant. I'm huge. My baby is running out of room. So my movements, they are slow and don't happen very often.
I know this definitely gets thrown around still to this day, but babies don't run out of room at the end of pregnancy. Now, the type of movements that they make may change, but babies should move up to and even during labor. If an expectant parent is monitoring their baby's movements at the same time each and every day, it should take about the same amount of time to still feel those 10 movements.
And then I was told, and I saw Dr. Google say, I should not go to the dentist during pregnancy, and I'm just going to avoid it for the next 9 months and never go again.
Well, good dental health is always important. Pregnancy can increase an expectant parent's risk of dental issues, thus overall health issues. This was a big one during the pandemic.
Yes. And then, like I said, I went to triage 3 times with my daughter, but they don't need this information, right?
Well, they absolutely should have this information. In fact, it's one of the most perfect places to have it. Posters, brochures, and discharge papers should all be used when someone comes in for anything and then is sent home.
So speaking of that, let's talk a little bit more about systems change. One of my favorite things to talk about is how you can integrate this into your system. I am happy to have other conversations about this, to look through your current workflow, talk through how to do this, because it is really easy. You can add Count the Kicks information to discharge paperwork, which I'm going to show you an example on the next slide. You can have all your front desk staff trained so they know how to utilize. If somebody calls with a change in their baby's movements, it should not be left to a voicemail. It should not say, we'll call you back. It should go directly to the nurse or provider. If you're a home visitor or WIC, can you include this in family care plans, intake forms, where you say, okay, are they pregnant? Yes or no? If so, how far along are they? Then can you add a note saying, I'm going to talk to them about Count the Kicks at 28 weeks. So put it on your calendar, put it on their documents. Glucose test. If I have any doctors or providers or clinicians on today, can you, in Iowa, where I went anyways, I had to take the glucose test in the office. The nurse stood there and stared at me while I chugged that lovely drink. And then I sat there for an hour waiting for my blood and waiting for my appointment. What a great opportunity to say, hey, while you sit here on your sugar high, go ahead and read this brochure, download the app, and we'll talk about it. EMR, EHR is one of my favorite pieces, because then you don't have to think about it. It's already integrated into the system. There should be a pop-up that says, have you talked about fetal movement today with your patient? Did you ask this question? Why can't we implement something like that? It's so simple, and we can help you with that. And then another great useful tool, add Count the Kicks to a phone recording. If you have a waiting room, we can get you slides, we can get you YouTube videos to kind of rotate through. There's a lot of different opportunities to integrate this into your workflow. So one of the examples I wanted to show you on the next slide is this after visit summary gold standard form. So we have health systems all throughout the United States utilizing this. And so what we did is we added some language with the QR code to the app. This would have been awesome for me with my daughter, right? I could have just gotten this printed. She could have gone through it with me. Super easy way. We have other pieces too. We have childbirth lesson plans, other things that we can talk about. So these are just some simple things to get you thinking about how to integrate this. Here's a partnership example out of Ohio. Celebrate One. During this event specifically, they hold this event where it reaches about 2,000 people every year, but it's a one-stop shop. So they have to give these expectant parents all of this education in one-stop shop. So they're like, how do we do this, but make sure that we're addressing Count the Kicks? So we worked with them to add a script on here so they would say it, and they'd hand them the brochure and talk to them about it. So simple things like that. Jody and I are more than happy to work with you on it. Just feel free to contact us, and we can send this all to you electronically. We can get you what you need based on your workflow. Now we're going to watch from a mom in Maryland, Delaware area, Lainey's Lap of Love. Her daughter, Brittany, Brittany's the mom, her daughter, Lainey, was a stillbirth, and she talks about the importance of why this is so important to her, but to others, to have Count the Kicks and fetal movement monitoring education in the state. So let's watch her story.
I think that it's going to be a powerful thing, just seeing so many people come out and support it. And I just hope that, I don't know, I hope I can be in the moment at the time and just really like sit back and be like blown away by what, you know, I've been able to accomplish with this walk. There is a lack of education and people talking about stillbirth still happening in this country, and you know, the whole your baby's running out of space, that's normal in your third trimester. Like, that's not okay. It's not acceptable to be told that. And I think that we just need more support on this so we can fund and educate doctors and offices so this doesn't keep happening. Searching through different social media platforms of trying to find a way to like grieve and figure out the grieving process. I came across Liddy's Loops and some others that have honored their babies in that fashion, and I was just like, wow, this is amazing. Like, not only are they getting to honor their baby, but they're raising money for such a great cause with the Count the Kicks campaign. So I was like, I want to be on board for this. I want to do this for my child. I remember something that one of the nurses said to me when we were in the hospital with Lainey. She just held my hand. She's like, can I pray with you? And I said, sure. And she said, you know, did a little prayer with me, but in the end she said, she's going to give you a voice. And she's like, your girl Lainey, she's going to give you a voice. And I truly do believe that. And that stuck with me for some reason. And when I decided to start the walk, I was like, man, like, she really is giving me a voice. Like, I do feel like what I'm doing is very impactful, and I hope it does save more than one baby. You know, I take it a day at a time, but like, one baby's one baby, and it's one baby that doesn't, you know, one family that doesn't have to go through the experience that we did. So it's amazing.
So that was last year. Lainey's Lap of Love happened, and that helped raise money for Delaware and Maryland to do social media ads towards expectant parents to download the app. We're going to the A1 conference with our ambassadors. So Lainey definitely gave her a voice. And I think that's true how we want to work more with like Maryland Patient Safety Center and things like that. And Brittany's so happy and honored that her voice is being heard, essentially. So Jody's going to talk. We're going to wrap up and talk about a little bit more of our great resources, and then we're happy to answer any questions that you may have.
Yes. All right. So we are going to remind you that these resources are free in your state. You can just scan the QR code or visit counttthekicks.org if you didn't get a chance to do that earlier when we had you do that then. But yeah, this is just a reminder for you to go ahead and get those education materials. They are delivered usually pretty quickly, and you'll be having those in your hands in no time. So we make it really easy for you. We also offer CE training at a low cost of $40. This training will help healthcare professionals know how to talk to their patients about fetal monitoring and using best practices to do so as well. We do have 2 Maryland ambassadors who are repping Count the Kicks there and who are set out to do volunteer opportunities, speak at events, go to baby fairs, things of those natures. These are our boots on the ground in terms of helping to carry out our message of Count the Kicks. So if you're wondering what a Count the Kicks ambassador is, and if maybe you would like to sign up to be one, it's just another great resource that our organization has, where we have women from all over the country sharing our message. These women are volunteers who are passionate advocates due to their own personal experiences. So like Brittany, for example, she's a community advocate, but she is a lost mom. We have those who are ambassadors who are doulas, nurses, the whole spectrum of folks who are impacted by this line of work. Our ambassadors also go to events like medical conferences and baby fairs, like I mentioned, do media interviews as well, work to grow partnerships, fundraise, and more. So if that is something of interest to you, you know where to find us. So let's talk about some next steps after you leave this webinar and might be back in the office come Monday, but really familiarize yourself with the Count the Kicks app. Give it a download, play around with it, get familiar with it. We can also have you order those Count the Kicks materials at counttthekicks.org. This might be a good chance to designate somebody within your office space or work environment to oversee ordering materials to make sure that you never are low on them. Also, take time to educate yourself. Make sure you have the kick counting conversation and educate others, I should say. Make sure to have the kick counting conversation at every touch point in the third trimester. It could literally save a life. It's important to do so. Also, make sure your entire staff knows about our Count the Kicks program and campaign and the importance of tracking fetal movement. Also, we really encourage you to debunk those misconceptions and encourage expectant parents to speak up if they notice a change in their movement. And last but not least, remember that hours and minutes matter in preventing stillbirth. Educate parents and staff on how to expedite concerns when an expectant parent calls or comes in saying that their baby is moving not like it normally does. So you can follow us on social media. We're everywhere. We have 2 accounts that you can follow, Healthy Birthday and Count the Kicks. So we're on Facebook, Twitter, YouTube, Instagram, all the stuff. Also, I would like to give you an opportunity to scan the QR code here on your screen to sign up for our monthly newsletters as well. So that concludes our presentation. Thank you so much for having us. I want to open it up for anyone that has any questions. Yes. Oh,
yeah.
Go ahead.
Yeah, I was just going to say, I'll just echo, thank you all for your time. Thank you to the Maryland Patient Safety Center for partnering with us and bringing our evidence-based program to all of you. We're so excited to be in your great state. But yeah, happy to answer any questions. I don't know if people are, you can unmute yourselves, I believe, or use the chat or maybe raise your hand.
Yes, they can do any of those things.
I'm a doula and a client keeps saying her baby's kicks changes and baby isn't moving as much. Her estimated due date is May 4th. She keeps going to the hospital, but they're saying, my question then would be, what kind of tests are they doing? I'm assuming they're doing like a biophysical, ultrasound, things like that. I would follow up with that. And I would say if she's keeps having questions and concerns, she should still keep going. I mean, they should be doing those tests. They should be following up. They should be making sure that she feels comfortable and confident before they leave. So I would, as her doula, maybe be asking those questions if they're not already doing some of those tests. I hope they're doing more than just the Doppler. So I would make sure that's all happening. And if it is, I would make sure that you know, talking to the providers and saying, she's still not confident. Like, I know you've done all these tests. Like, what can we do to make sure? And maybe the app will help her. Like, maybe she could download the app and start using it.
And Dominique, I would also add to that, if it's possible for maybe you to go to that next appointment with your client, because obviously there's a lot of, maybe there's high stress at stake here, and there's a lot of conversation going along. So you might be able to help be her voice in that room and ask for those questions, extra testing, what type of tests, things like that, and to document things as well. So you can help her out in that way.
Yeah. She doesn't like the app. She does like the app. She was using it first, like the idea. Yes, absolutely. Is there any work on expanding to lower gestational age? Great question. Not with us that we know about. We look at research all the time. We work with specialists and providers. We go to conferences. I'm going to the International Stillbirth Alliance conference here in June. That's where we got, you know, to add strength. And so we're really following what the research shows, and what research shows is that pattern, that trend starts to show around that 28 week, 26 weeks that they're high risk. So that's really the timeline of where we're impacting stillbirths. So I have not seen any research about preventing stillbirths earlier and programs to do that like that. But we stay on top of it. So I'll let you know if we ever find out that. Great questions.
I just wanted to put a plug in that if any of you have any colleagues or friends that would be interested in this information, we're from anywhere, from the hospitals, from the community, our doula friends, anyone out there that you think that this information would be valuable to, anyone who cares for birthing people, there's another webinar. We're redoing this again on May 1st. And so we would love to have them attend. So please pass that along. I will be reaching out from the Maryland Patient Safety Center in the next few weeks, making sure this recording gets out to you and following up, making sure that you were able to access resources and to see if you have any additional questions and just better understand how you're doing implementing this, because, as I said, the challenge has been accepted from Megan and Jody. We want to see a reduction in Maryland that even exceeds the great reduction that they saw in Iowa. So, and I think we can do that by downloading the app and making sure everybody receives standardized education on stillbirth prevention. Tina had a question, Megan. It says, which Count the Kicks app is yours?
Yep, I'm showing you. I don't know where my video went. Is my video still on?
I see you.
There's only one, and it's the yellow clock icon that you see in the store. Sometimes if you're searching in like the Apple store, if you just search for Count the Kicks, what will happen is you'll see two things, but one will show up in the watch for like a watch, and the top one is for the mobile app. So I think you can access either one for both, but it will look like the yellow. I don't know where am I showing you on the camera?
Yeah,
we can't quite see it.
Just unblur your background. So
okay,
yeah.
And while she's pulling that up, Rhoda, you asked about, could you include info regarding upgrading training to registrants? Sure. It said it was forwarded to you by a colleague. Yes, it wasn't just sent to the Perinatal Quality Collaborative. It was sent out to anyone in the Maryland Department of Health, through the Maryland Department of Health as well. So that might have been how you got that, but I will send it to registrants as well. Could everyone see, Megan, the app?
It's that yellow clock icon one.
The yellow with the clock.
Yes, and Tina, it is available on Android as well. Yes.
Yep. Okay, I think that's it.
Awesome. Thank you, guys.
Thanks.
Thank you so much, Megan and Jody. It was great.
Thanks, Adrienne. Have a great day, everybody. Have a good weekend. Bye.
Bye.